Now there are various methods of delivery once you have the medication in there, again depending on the age of the person. For myself, as I was mentioning, my first experience with the nebulizer was when my son was about 9 months old, and he probably would not have tolerated the mask being on his face. Most kids that age are going to try to tear at the masks and make an experience all the way around. Older or adults, one way of delivering the medication, I'll show you right here, is to be able to actually, again, this is just one of many different ways. Putting this together like this, you've got the tube here, and then this is the piece, you want to turn it like so, that they can actually put in their mouth. And then once you have that assembled again, you're going to kind of push and twist a little bit, and then the person would actually hold it and put this in their mouth and be able to breathe the medication in that way. So that's one way. And then the other method, for a child, obviously this is for a child's use. It's got the dinosaur on it, and my kids did appreciate that. The mask form, and all you have to do is directly put the mask right onto here. And then, of course, this would go around the child's head, and they would be able to just go ahead and breathe in it. And as this allows for some airflow out the tube here, this also allows for some escaping of air and mist through the holes right here. So it's not something that's going to be kind of a suffocating type of experience.